parts includes bones, ligaments, cartilages, and joints. It is divided into two: axial with 80 bones and appendicular skeleton with 126 bones. That's why an adult human skeleton consists of 206 bones. Its functions is to support the body, protect soft organs, aid in movement, stores minerals and fats, and involved in blood formation.
Bones are classified according to its shape. The long bones, they are typically longer than wide, example the femur and humerus. Then the short bones, they are generally cube-shaped and contain mostly of spongy bone, example the carpals and tarsals. The flat bones, they are thin, flattened, and usually curved, example the skulls, ribs, and sternum. And lastly is the irregular bones. They have irregular shape. Example to that are vertebrae and the hip.
Let's examine the long bone. Below are the types of synovial joints with examples. 1. Gliding joint. An example would be the joints between the carpals and another example would be the joints on the vertebrae. 2. Hinge joint. Examples are elbow joints and the knee joints. 3. Pivot joint. Examples are proximal radio-ulnar joint and the median atlantoaxial joint. 4. Ellipsoid joint. Examples of this type of synovial joint are the radiocarpal joint and the metacarpophalangeal joint. 5. Saddle joint. The best example for this joint would be the carpometacarpal joint, also known as the thumb joint. 6. Ball and socket joint. Examples are the joints in the hips and shoulders.
Muscles are the only tissue in the body that has the ability to contract and therefore move the other parts of the body. Related to the function of movement is the muscular system's second function, the maintenance of posture and body position. Posture, such as sitting and standing, is maintained as a result of muscle contraction. The skeletal muscles are continually making fine adjustments that hold the body in stationary positions. The tendons of many muscles extend over joints and in this way contribute to joint stability. The facial muscles serve two major functions for the body: mastication and facial expressions.
The three muscle types. These are the skeletal muscle, smooth muscle, and the cardiac muscle. First is the skeletal muscle. It is cylindrical in shape. It is voluntary, striated, and it is attached to the bones. The location of its nucleus is in the periphery of the cell. Next is the smooth muscle. It is spindle-shaped, involuntary, non-striated, and it is found in the walls of the organs. The location of its nucleus is in the center. Last is the cardiac muscle. It is involuntary, striated, and only found in the heart. Its shape is intercalated disc.
Anatomy is named the skeletal muscles according to a number of criteria, each of which describes the muscle in some way. This includes naming the muscle after its shape, fiber direction, location, number of origins, or its actions. The name of some muscles reflect their shape. Direction of the muscle fiber. Example, rectus abdominis. Large muscle in front of the abdomen that assists the regular breathing, movement, and supports the muscle of the spine. Relative size of the muscle. Longus is to abduct the thigh and it's innervated by the obturator nerve. Location of the muscle. Example, frontalis muscle. This muscle is found in front of the body, and frontal is a Latin word means front or in front. So that is why frontalis muscle belong to the criteria of location of the muscle. Shape of the muscle. Deltoid muscle. It is a triangular in shape. As a result of this, the Greek letter delta is the name given to the muscle. Action of the muscle. Adductor. Muscle that support balance and alignment.
Body movements. First, lateral flexion in intervertebral joints. This type of movement is commonly associated with the neck and spine. Second, abduction in shoulder joint is a result of upward scapular rotation. Third, adduction in shoulder joint is a downward movement of humerus medially toward the body. Fourth, lateral rotation in shoulder joint is a rotation movement away from the midline. Fifth, medial rotation in shoulder joint is a rotational movement towards the midline. Sixth, flexion in elbow joint involves decreasing the angle between the forearm and the arm at the elbow joint. 7. Extension in elbow joint involves increasing the angle between the arm and forearm. 8. Extension and flexion in hip joint. Pushing the leg toward the back is termed extension. Raising the leg toward the front is termed flexion. 9. Hypertension in hip joint is an extreme version of an extension, has an excessive joint movement in which the angle formed by the bones is opened or straightened beyond its normal healthy range of motion. 10. Extension in knee joint. When standing up, the knees are extended, describing as a straightening movement. 11. Flexion in knee joint. A bending movement around a joint in a limb as a knee. 12. Dorsiflexion in ankle joint. Movement of the foot upwards towards the lower leg. 13. Plantar flexion in ankle joint is a movement in which the top of your foot points away from your leg. 14. Inversion in intertarsal joints. It involves the movement of the sole towards the median plane. 15. Aversion in intertarsal joints. It involves the movement of the sole away from the median plane.
The nervous system is the master control and communication system of the body. Every thought, action, and sensation that you have is a reflection of its activity. It communicates with body cells using electrical impulses which are rapid and specific and cause almost immediate responses. The neurons are known as nerve cells. Its major function is to transmit nerve impulses or messages into, within, and out of the nervous system. Neurons are responsible to communicate electrical signals like producing body movements in response to stimuli or sensations.
The common senses of human body are sight, smell, taste, and hearing. These senses are considered as special senses. These are functioned by complex sensory organs with special sense receptors. Pain, temperature, and pressure that the skin recognizes is part of sense of touch or tactile senses. General senses include tactile senses and senses of the body position and movements. The eye or eyeball is the organ responsible of sense of sight. The internal and accessory structures of the eye support the functions. The ear serves two functions of senses, hearing and balance. Sound stimuli are captured by hearing receptors, whereas equilibrium receptors maintain positions and movements of head. These receptors work independently as it will react to stimuli. The mucosa of nasal cavity contains olfactory receptor cells. The taste buds in the oral cavity consist of gustatory cells which is responsible for the sense of taste.